day, and thank you for joining us here on Digital Dialogues. I'm Steve Marion. I'm your host, the Senior Director for Customer Success here at Quantum Strides. And today I have a great guest with me, Joe Brothman, Director of Facilities and General Services for UCI Health. How you doing today, Joe?
Doing good. I'm glad to be here. Thanks for inviting me on your show today. Really excited to be here.
Fantastic, fantastic. Love to hear that. So, Joe, listen, to get this kind of kicked off here, where are you from? Where do you hail from?
Southern California primarily. Spent a little bit of time in Park City, Utah, but primarily from Southern California, Orange County. Grew up in Ventura, but from, let's see, about sixth grade on through college and post grad, all my time here in Orange County. So I'm really a Orange County native and still reside in Orange County. It's been like 22 years now
Oh,
here.
wow. Wow.
Yeah.
Fantastic. Fantastic. I'm an East Coast guy myself. I'm actually based out of Metro Atlanta, but I was born and raised in Philadelphia, from one coast to the other. So, one of the things that I noticed, Joe, in your profile is you mentioned a journey of over 16 years in hospital operations and facilities management. And I have to ask, what first drew you into this field? And how was your perspective, has it evolved over time?
Sure. My very first job was a hospital's facility mechanic when I was 15. So when I was looking for my very first job, this came up. I was applying all over the place, just looking for any job I could just for gas money. And I had a friend who was a hospital facilities manager, and he knew that I was looking for a job, and he knew that I was applying for a local furniture job, and it wasn't a very good job. And he offered me a hand and said, "Why don't you come over to my place, and I can give you $20 a day cleaning up my shop after school." And that was enough 22 years ago now to give me more than enough gas money. And little did I know at the time what it would work its way to. But yeah, that was actually my very first job. I started as a shop hand, I like to call it, but it was a per diem role, facilities mechanic that only lasted for about a couple weeks before I became a part-time facilities mechanic. And I worked my way up through the mechanic side for about 12 years through mechanic and then carpenter and journeyman. And then I started through the emergency management side, safety officer, and then environmental health and safety, and then became over time facility director, general services, and where I'm at now. So it's been a journey, but didn't know at the time what I was getting myself into. And looking back, it was a really unique perspective how I got into it. But it was really, this is my second job. My first job, I never left the place. I only left when I came to UCI Health when I was leaving grad school. I stayed at my first job all throughout high school, college, and just left when I was finishing up my graduate program. So,
Very nice. Very
yeah,
nice.
pretty interesting. Yeah.
Yeah, man of many talents. Managing facilities in a healthcare setting comes with some unique challenges. Could you share one experience maybe that tested your resolve and what it taught you about this industry?
Sure. Yeah, it's hard to pinpoint one, but one more recent, we all have mentors, and especially myself, I've learned so much from a lot of people. But right before COVID struck, I was asked to take over the facilities department at my institute, and I learned so much from my predecessor, who was the facilities director, and he was retiring, but I was learning a lot from him before he left. And when he retired, I didn't really have any of those mentors left. He was the guy that I was learning from for the last 10 years. And so going into COVID, I felt on my own. And that was a really big test to me. It felt going into this unknown world without really having another dude or a mentor to do this with. But I found a partner, a couple, or a whole team really, who I did that with. And it was really humbling experience, but it was really neat to get your feet on a new platform and build a new team and to see that team grow and to not be the captain, but be part of the team and to lead it. It was really a neat experience. And it was scary, definitely scary, but it was a neat experience to be part of. So probably not typical, but definitely one that I think tested my resolve and definitely had some shaky points, but was a neat experience for me.
And here you are, still standing. So
Yeah, we're still standing. Yeah, yeah,
that's
we're
right.
thriving. Yeah,
That's right. That's the great
yeah,
news. So now, being in healthcare, I'm sure that in your role, you face crisis situations from emergency preparedness to regulatory compliance. What personal qualities do you feel are essential for leading through tough times?
it's a complex situation. Those types of situations are always complex, but being able to navigate those situations and remain calm and concise. And you always have people who are going to be asking a lot of questions and having the foresight to know what, or at least have the auspice to know or put out the picture that you know what is going to happen is a really great quality, even if you don't know, because we're all human. That's a really valuable quality. And I don't want to say pretending, but putting out an aura of confidence so
Yes.
that people want that. People need that. And especially in times where there is a lack of it, because hospitals and healthcare institutes are high stress on a good day. When things don't go to plan, that creates a lot more stress and a lot more shaky ground. So when you can be that stable ground and when you can be that place where people go to for that stability, people appreciate that. And even if you're yourself on the inside, you might not know that answer, but if you can portray, that's a really good quality to have. So it might not be the right answer, but if you can portray that and if you can be confident enough to make a decision and go with it and be humble enough to change or course correct and admit when you made a mistake, people respect that.
Absolutely.
So being humble enough to admit it, but being confident enough to make a decision, I think those are qualities that people need in those kind of situations. But just knowing that you're a human being and making the decision in those types of situations is what people need.
Awesome. And I absolutely agree 100% with your assessment there, which actually brings me to another question. You mentioned fostering an equitable and diverse team environment. How do you approach building a culture of inclusion and support within such a high stakes industry?
By giving opportunities, mostly, you need to, or we need to provide opportunities to everybody, all sorts of team members, and people from all shapes and all walks of the earth, or however you say it. But I guess there's a role and a place for everybody. And there's definitely a place for people with tons of experience, but there's also value in giving people opportunities to create experience. So, in my opinion, I like to provide people opportunities that sometimes it's good to bring people in with 50 years of experience, and sometimes it's good to give people who have no experience the opportunity to make a name for themselves, so to speak. But there's no right answer to that. There's tons of opportunities out there. And I think there's never been a better time for managers or leaders to create opportunities for people of all walks of life to have choices for the people that they choose to hire for roles. There's more people out there in the job market with experience and lack of experience and with unique skill sets to fill those positions. So I think depending on the types of roles that are out there, you can either have people with tons of experience in that exact role or people with unique skill sets and unique tools to bring a different perspective to a job that they may not have experience in. So looking at positions differently or depending on what is needed for the position, it's all about what is needed at the time. So I don't know if that's exactly answering the question, but I guess it's all about what is needed at the time and looking at the need a little bit differently than historically what has been done before.
Yeah, no, I wholeheartedly agree with that. And so now I want to ask you a little bit about your perspective on facilities management, particularly healthcare facilities management and technology. Like, what are some of the trends that you see shaping the future of facilities management and healthcare, especially with the growth in technology and sustainability efforts?
I think for sustainability, there's definitely been a push for electrification, which us at UCI Health has been really exciting the last few years because we're building one of the first all electric campuses in the nation, which is really exciting to be part of. We're pioneering the nation's first natural or carbon combustion free medical centers. So we're going to be going live with that in 2025, which we're
Nice.
very excited for. I think there's also a big push towards big data for looking at our CMMS platforms and looking at how we can better utilize data for our asset inventories and looking at our metrics and predictive analytics a little bit better
Mhm.
to predict how we can do things a little bit more preemptively rather than reactionary to either be more efficient or sustainable or do things before things break rather than just trying to fix things.
Sure.
So if we can get ahead of the problem rather than it getting ahead of us, we
Mhm.
can both save money and we can do things more efficiently. It could be better for the patient, be better for the building. Also, if we can make things safer, both for the occupants and for coworkers, hospitals are currently the most dangerous place to work. If you're looking at
I didn't
occupant
know that.
safety, both with workplace violence prevention and with accidents, very high level, we can crunch some accidents and injury numbers and try to figure out what is causing these injuries from happening, what's the causation, and be more proactive with mitigation measures rather than reactive. Not to be too ambiguous, but there's some really neat things going on that could mitigate some high level injuries or
Mm.
be more proactive with our mitigation tactics than reactive.
Okay. Okay. Thank you for that. Now, your work involves both emergency preparedness and new construction projects. How do you balance that proactive planning with the need to remain adaptable and responsive?
I'm really fortunate that I get to partner with some really great team members who oversee our new construction projects. And so they elicit my teams whenever there is a new construction project and ask us for best practices or where pain points are, or if there's things like lessons learned or things we should have done differently for the new project. It doesn't mean that they're always implemented, or it doesn't mean that each new project gets 100% of what we ask for. But every time that we get to be or provide input to those stakeholder meetings, those planning meetings, we get a little bit more involved. We're working really closely with our planning, design, and construction team now to develop specs for new projects, which is really exciting because those are going to be what I like to say it's for our posterity. We're going to be programming specs for buildings that, well beyond into the future will be programming for the future, basically. That's really exciting stuff to me because we're going to take best practices and lessons learned from the many projects that we've done so far and hopefully make something that's programming language for the many projects that will come after we're gone and implement best practices and the pain points that we've gone through so that we don't have to go through it again. A lot of places have already done that, but we're just learning how to do that now. That'll be a big step forward for us. In terms of resilience and with some of the things that on the other hats that we wear, we like to try to implement resilient design into our construction. So lots of that programming work that we input is based on resilient designs and looking at the type of building that we're going to be building or location of the building or the function of the building, where it's going to be, the occupants and the function of the space and where and who it's going to be built for. Once we understand that and get a little bit more knowledge of the scope of the building, we're able to provide input on the best practices for resilient programming for it. So there isn't a one size fits all. For our new hospital, for instance, there was a tunnel being built and it was underground with a lot of heating hot water piping built in. One of the only inputs to the new hospital that tunnel led into was a single door that led into the surgery space. And we made sure that door had a 2-foot curb and a submarine door, because if there was any burst of one of those pipes, we would have flooded out the whole surgery suite. We try to pick out the worst case scenario and plan for that and hope that nothing bad happens, but you plan for the worst and hope for the best. That's just one example, but
Yeah, which is interesting. Something else I've noticed, you've been a member of state and federal emergency management groups. What would you say might be one piece of advice you'd give to facilities managers who are new to crisis management?
it's hard to give one piece of advice, but probably don't wait for something to happen. Probably start planning right now for things. But it sounds cliche, but it's not a matter of if, it's going to happen. And if you've waited for something to happen, you're pretty much too late. We probably never thought that there was going to be a worldwide pandemic. If we thought that there was going to be we're on different sides of the continent, but in California, we always talk about the big one, and we always plan for that.
Yeah.
Our hospital, it's not even, it's a couple hundred beds, but it costs an absorbent amount of money because we plan for the big one, and it planning to withstand a 7.0 earthquake. You don't have to do that everywhere. And thank God you don't, because it costs so much money to plan for that type of structure in this type of earthquake zone. Over there, though, you probably have to plan for hurricanes, and you probably have to plan for other things. And we don't
Yeah.
have to do that
No,
over here.
not so much snow
Yeah.
here in Atlanta, but yeah,
Other stuff. Yeah,
hurricanes
right.
and
Yeah.
tornadoes.
Yeah. And if you didn't plan for that during the construction when they come, or if you're in Florida and you plan for a hurricane just when you see it on the Weather Channel, it's not going to work out for you very well. Those kind of things, again, it sounds cliche, but you can't be too early to start. And then also wear the cargo pants, be the person who is the guy who, or the person who is always reminding everybody that these things can happen, because when it does happen, you're not going to be the weirdo. You're not going to be the crying wolf. They're going to be appreciative, and they're going to be thankful that someone was wearing the cargo shorts and had their go bag in their backpack and their car and everything, because someone has to be that person. Someone taught me that a long time ago, and they were very correct. And I think, COVID taught us that, and it's very true.
Sounds like some sage advice.
Yeah.
So, your involvement in the California Society for Healthcare Engineering shows a commitment to the professional growth of others in the field. What motivates you to give back in this way?
Yeah. CSHE is a great society. It's part of ASHE, the American Society of Healthcare Engineers. I credit them with a lot of advancement in my own personal career, but they also are wonderful in organizations that help promote both the industry I'm part of and develop the organization and the industry as a whole, and advocate for the industry on a professional development nation. Part of that is professional development, which I strongly believe in because I see a lot of my peers growing professionally, and I've seen it now. I've been part of this industry multiple decades, and I've seen wonderful success with my peers, and I love seeing that. It's really great seeing people become wildly successful through what we do. So it's just, I think more than anything, the personal growth and success that this industry can bring people is why I like to see that happen. But also, these professional organizations bring personal growth to people. And you don't have to be a doctor or a nurse or a lab technician or anything like that to be part of the care continuum. You can be a laborer, you can be administrator, you can be a manager and be part of that care continuum. A lot of people don't understand that. And our industry provides that avenue. So I love it. I think it's a great industry to be in, and I'll always promote it. I think it's a great avenue for people like us who want to be part of the care continuum, want to be part of the healthcare industry, but maybe aren't a healthcare professional, but we are part of the tradesmen's and we want to be part of the healthcare industry as a whole, though.
Yeah, no, that's great. Now, let me ask you, when you look back at your career, what accomplishment would you say you're most proud of, and how did it shape your approach to your work?
Just feeding off of that last question, we've developed a lot of people through my career, and I'm really proud of that. So we've brought a lot of people professionally up through the ranks. I'm seeing a lot of people grow professionally and personally, and that makes me so happy and proud. I don't think anything makes me more happy than seeing young professional maybe starting as a day worker who's like, I kind of like this job, and then 10 years later they're becoming an executive or something, which we've done a couple times, or a security guard or something like that. And I love that. That honestly is my favorite thing in the entire world to see. I also love the emergency management part when you have a huge, big issue and you can resolve it, or disaster management when you have again, a big, huge issue and you can crisis manage it or project manage it. But there's nothing better than seeing professional development or personal successes, especially over years if you get to work with that person. Those are my absolute favorite things. And healthcare is one of those industries that you see people, especially in my area or my neck of the woods, we say it's an incestuous industry because we see people for decades. I
Mm.
have some friends I've seen at multiple hospitals for decades and seen them grow professionally tremendously. And it's so neat to see that. I love it. And I know they say the same to me. We've seen each other grow and everything. And there's nothing better than seeing that. So that's my favorite part of it.
Yeah, it definitely seems like a fraternity.
Yeah, absolutely. Yeah.
Yeah, yeah. With that in mind, I have to ask, so there are going to be people who see this podcast, this video, people who may not be in the FM space right now, but they see this video and think to themselves, they might be a tradesman. And they think to themselves, boy, this Joe Brothman guy, I think he's got something that I might want. What advice would you give someone who's, considering a career in facilities management?
It's a good question. I think first off, joining or going to one of the California Society of Health Engineers or one of the many American Society of Health Engineer Trade Association group meetings to see if it is something that they would be interested in just to get their feet wet would probably be a good primer, because you can meet and talk and learn a little bit more about it, more so than just hearing a guy like me talk about it. You can learn and ask questions and see what it's all about. You could also apply and there's jobs all over the place. I have tons of jobs open right now. I know tons of places have jobs open right now. And if you are a tradesman, there's so many specialties in the trades and the skilled trades and the non-skilled trades and the professional side. There's so many jobs open right now that if you are interested, I know that there are plenty of openings available. Depending on where you are, there's probably something nearby. Having the time to look that up, probably asking someone like me just for some time, I'm sure someone would give you a little bit of time to ask some questions and just see if it is a good fit. I'm sure someone would be willing and able to give you a little bit more time. But my first is always to say just go to one of those trade meetings and see if it is a good fit, because you can learn a lot by seeing who goes to those meetings, seeing what the conversations are like, and just seeing if you're a good fit with that group. Because you can learn a lot just by attending one of those, and they're all free. No one charges for that first meeting.
Awesome. Awesome. And final question. You're out in Southern California. Rams, Raiders, or Chargers?
Oh, I thought you were gonna ask Clippers or Lakers, but let's see.
Okay.
Rams. Yeah, yeah, Rams
Okay.
are. Yeah. Rams for now. Rams have been a lot of fun to watch,
Yeah.
especially in the new arena. But Clippers. Clippers are my team. Everyone likes the Lakers. I'm not a Lakers fan, but the
Right.
Clippers are a lot of fun to watch because they're always an underdog. So yeah, Clippers are my team.
Oh, that's awesome. That's awesome.
Yeah.
Joe Brothman, I want to thank you so much for joining me today on Digital Dialogues. Educate and inspire. That's what we're looking to do here. And I think you've just done that with this recording. And look forward to talking with you more in the future. Thank you again for joining us today, and have a great rest of your day.
Thanks so much for having me. I really appreciate it. Have a good one.
Thank you.